A 52-year-old man with a sudden severe anterior chest pain. Can you please punch whether the voice is loud and clear? Akanksha is asking, where is this mock test present? We have it on the anatomy2medicine.com. You can call to the helpline to get an access to the mock test. The helpline number is 9000868 You can request how to get an access to it in the anatomy2medicine.com. Every Saturday evening we will upload the mock test, and Sunday afternoon 12 to 3 we will have a discussion. Yeah. Yes. Shibam, Kunjit, Commandant, Akanksha, everybody. So after admission she was noted to be hypotensive. You have done a Swan-Ganz catheterization. The right atrial pressure is elevated, and the indirect left atrial mean pressure is within the normal range. So what is the most likely explanation for this? Whenever inferior wall MI is there, the right ventricular infarction is what you see, and whenever right ventricular failure happen, then that lead to development of an elevation of the right atrial pressure is what you have to basically appreciate. A 50-year-old woman presents with a 24 hours history of palpitations. ECG shows atrial fibrillation. Please punch your answers, doctor. If you have not taken the mock test also, still you can quickly guess and punch your answer. Please punch the answer into the chat window. Yes. Shivam Panchal thinks adenosine. Oh, come on. Ventricular rate is 130 beat per minute. Which will be a rate controlling drug, and which will be a rhythm controlling drug in the management of atrial fibrillation is the favorite question of the examiner. Chaco and many others are thinking bisoprolol. No. Do wrong, but don't do a blunder. Not that wrong. Very good, very good. Flecainide, absolutely. Kunjit Joshi is absolutely right. Flecainide controls the rhythm, whereas if you take digoxin, beta blockers, diltiazem, verapamil, they all slow the heart rate, but they don't have effect on the rhythm, is what you need to remember. 35-year-old woman, early stage IV chronic kidney disease, blood pressure is 140/90, and mean corpuscular volume is 84. She has an arteriovenous fistula plan, and she was given a erythropoietin therapy. What is the most important thing about the erythropoietin therapy out of all these options? Should your answer, doctor? In this case of renal failure with AV fistula plan, early renal failure, what is the role of erythropoietin is my question to all of you. Praveen Kumar Shah, Huzaifa, you're all thinking D, okay, and Priya and others are thinking B versus D. B, improve the exercise tolerance. That is the most important thing. So whenever you give erythropoietin, what are the side effects, doctor? It can lead to a flu-like illness, hypertension, erythropoietin therapy. Don't forget. Mild hypertension is a side effect of the erythropoietin therapy. And that can lead to increased blood viscosity, which can predispose to thrombosis, can be the side effect of erythropoietin. There can be headache, disorientation, etc. etc. A 51-year-old, 2-year history, arthralgia, rash and fevers. I am very happy to see 104 online students. You will all enjoy this if you also are enrolling for the mock tests, and every Sunday you take 300 MCQ mock tests available on the anatomytomedicine.com website, where you will be given the login and participate in discussion, but still you can answer now. Yes. Yes. Priyanka like to bet it on henoxcholine purpura. So this is a classical story wherein patient is having intermittent episodes of arthralgia, rash and fevers, and the purpuric rash on the lower extremity, it is the SLE, classically a case of SLE with all that given hypocomplementemia and a elevated creatinine. All the complete comprehensive story fits into SLE. SLE will have arthralgia. So the rheumatological association criteria of SLE is very important. So you have a elevated ESR, C-reactive protein in SLE, a decreased complement of C3 and C4, and the liver function tests are mildly elevated. Creatinine kinase may be elevated if there is a myositis in SLE, and the creatinine spot protein to spot creatinine ratio is also changed. Now, 27-year-old woman with a right-sided thyroid swelling along with a cervical lymphadenopathy. Come on, this is what you have to answer this question confidently. Closing your eyes, you have to answer this question, right? Very good. Virat Viru says papillary carcinoma. Classically, remember, there is a cervical lymphadenopathy. 77-year-old, emergency partial gastrectomy had been done for a bleeding ulcer 9 months ago. Now, presently he has got anemia and diarrhea. Endoscopy shows an active benign looking stomal ulceration. What is the best clinical management of a post-gastrectomy stomal ulceration presenting with anemia? What is your answer, doctor? Right. So Kunjit Joshi says B. Vikas is saying endoscopic ultrasound of the gastric remnant. Right. Vikas is absolutely right that it is the fasting serum gastrin concentration which is very, very important to be remembered. So what are the post-gastrectomy syndrome, doctor? Gastric outlet obstruction, alkaline reflux gastritis, gastroparesis, afferent loop syndrome, dumping syndrome, efferent loop syndrome. These are all the complications of the gastrectomy is what you need to remember. Now a 70-year-old, 2-week history of persistent fever, colonoscopy shows a suspected carcinoma of the colon, and he has a moderate mitral regurgitation caused by mitral valve prolapse, and echo is showing vegetations in him. He is having a suspected carcinoma colon. What is the most likely causative organism? Come on, shoot your answer. Yes, what is the most likely causative organism leading to the vegetations and infective endocarditis in a person? Excellent, Shah Huzifa, Streptococcus bovis. Even without looking for options, that should come to your mind when you are reading the question, and you should be able to attack the answer.